So hello everyone and welcome to this press conference on the COVID-19 situation. Today, the Premier of Quebec, Mr. François Legault, is together with the Minister for Health and Social Services, Mr. Christian Dubé, the National Director of Public Health of Quebec, Dr. Horatia Arruda, as well as Dr. Lucy O'Partney, who is Assistant Deputy Minister at the Ministry for Health and Social Services. Mr. Premier.
Bonjour tout le monde.
Hello everyone. First, I wish to right away talk about the curfew that started on Saturday evening. I was truly impressed and touched to see how Quebecers have followed the guidelines. It was beautiful to see that Quebecers showed solidarity, that they remained at home, to make sure that there are as few contacts as possible so that we can finally break the second wave and reduce the number of hospitalizations and deaths. So I wish to thank all Quebecers. I also wish to thank the police officers. The police officers have done extraordinary work. We had told them last week that the approach was no longer to be one of warning people, but rather of giving people tickets. So during the two evenings, the two nights, they gave 750 tickets to those throughout Quebec. So it's a lot and it's not a lot at the same time, but the work was done well, and I wish to thank them, all police officers, for having the guidelines be applied, because that is something that is exceptional. It's the first time, I think, in Quebec that we have a curfew. At the least, that's what I recall. So, of course, this measure is serious because we have a serious situation. And when I say that we are in a serious situation, there's in particular two groups of people that we have to protect. The first group of people are all those who work in the health network. We know we are now today with over 1,400 patients with COVID in our hospitals. And of course, beyond the hospital beds that are occupied by them, it's the same staff that we have. It's the same nurses, for example, that care of COVID patients as much as other patients, which we could call regular patients. So it puts very strong pressure on our hospitals, most particularly in the Montreal greater area. Even if we take into account the ratio per 1,000 inhabitants, there are more cases and more hospitalizations in the greater Montreal area than in the rest of Quebec. So we have to be careful, because in the rest of Quebec, there are cases as well. And obviously, the capacity is not as great, but it does remain that there's tremendous pressure on health, and that is why we have Dr. O'Partney with us today, who is here to be able to answer questions and the difficult decisions that we are making as well to ensure that we have the correct dosage between the beds that are available for COVID cases and those that are occupied, whether it be for emergencies or surgeries. These become choices that must be made by specialists who know what it's about. So when I say that there are two groups that we must protect, well, of course, the other group are the vulnerable people. Today, we have 51 new deaths. That's a lot of people. There are people who are more vulnerable, most particularly the elderly. And now I would like to, if there is one message that I would like people to keep in mind today, it is the one to be careful with people who are 65 and over. I'll give you just two numbers that signify everything. 80% of COVID patients are 65 and over, and 95% of the people who die are people who are 65 and over. So that means that if we all get together as a team and work together to avoid contacts with people who are 65 and over, we are going to be able to fix a great part of this problem. And I understand that it happens that there are people 65 and over who are alone, who need caregivers. What I would dare say is that we'll catch up after. We hope that the second half of the year 2021 will be somewhat easier. So let's calculate the number of times that we would have gone to visit the people 65 years and over, and we'll add them up and we'll go more often after. But right now it's important to do everything that we can in order to avoid contact with people who are 65 and over. Of course, vaccination, the Minister for Health is going to talk about it later, but it's going well. We've vaccinated about half of residents in CHSLDs, and there will be a sequence after that. It'll be the residences for the private residence for the elderly, and then it'll be the elderly at large. So, of course, it's going to come earlier rather than later. And you've seen the numbers. We have administered 80% of the vaccines that we received, the doses that we received. We are the province up until now that has done the most in percentage of what we've received. And as we get them, as we've said already, we do have a capacity of about 250,000 per week, and we are promised 250,000 by the beginning of February. So there is absolutely no problem that all the doses will be used. And it's a little bit like the light at the end of the tunnel. And I say that to the people who are 65 and over because I don't want to stigmatize them. I don't want to point them out or point a finger at them. It's just factual. These are the people, 65 years and over, who are the people who have the most vulnerability, as well as people with underlying health issues. So let's be careful. And if you are 65 and over, be even more careful and take care of yourselves. Which brings me to talk about the younger people. Well, first, you have no idea how happy I was to see the images today of youth going back to school in primary school with the big smile, to see their teachers and friends. It's beautiful to see that. I hear, and I was reading certain messages, there are people who are saying that it's risky sending children back at school. I'm not going to try to make you believe that there are no risks, but it is a calculated risk in the sense that, first, there are other inconveniences if children do not get sent to school. Not learning, they've already missed a lot of weeks over the spring. It's going to be difficult, and you saw it on Friday. The Minister for Education talked about the measures that are being set up to allow people to catch up in the tutoring, and we're going to do everything for them to be able to succeed their school year, but it remains that we cannot keep children at school. There's also a question of socialization. They wish to see their friends. So it's very important. And also just to say, we're not forgetting the younger people from CEGEPs and universities. You know, some people have said nobody's talking about us. Well, we take it for granted. And I know that it's difficult for them, that they're a little bit more able than the younger ones to learn remotely. But I know that it's hard to not see one's friends, to not get a new boyfriend or girlfriend. So we're working on that together with public health. We're putting a lot of pressure on public health for there to be some possibility of learning in person soon in CEGEPs and universities. But I just wish to say that it's a calculated risk, and I accept that choice. There are other places, you know, in Ontario, even doctors who say, oh, I wouldn't have sent the children back to school, but it's part of my job to make decisions. And I think that there are more disadvantages than advantages in leaving children at home. So I totally shoulder that choice. But what it is important to clarify is that children who go to school, it's even more important for them not to see their grandparents of 65 years and over. And as I was saying last week, it's not a good idea to have one's children babysat by people who are 65 and over, because young people don't have much risk of suffering serious consequences, but they can easily transmit the virus to people 65 and over. And people who are 65 and over, they are at risk of having serious consequences. I would like to add on an encouraging note. So you can see with the number of testing that's been done in the past few days, there's either a lot of tests or not a lot of tests. What is important is the positivity rate. We are at about 7% positivity rate right now. That it's a net improvement. There were days at 11 and at 10 last week. There was one day at 8. Certain days we're now at 7. Of course, we can't take anything for granted. Tomorrow, we don't know what it'll be. Don't know what it'll be the day after that. But right now, we do see that we're down to 7, and that is good news. And also, perhaps, just to reiterate, and Dr. Arruda has explained it often, first come the cases, a few weeks later the hospitalizations, and then the deaths. So as you can see today, there are relatively a lot of new hospitalizations and deaths, but the fact that there are few cases, if we look at it proportionally, is encouraging for in 2 weeks, 2.5 weeks. That means that perhaps the measures which we announced Wednesday, I think that some people started applying them even as of Wednesday. I think that for the time being, it looks like it will give good results. So Quebecers are able to really hold themselves as a team, and they can play as a team. And I wish to thank all Quebecers for their efforts in coming together.
I want to say that I was very impressed to see the solidarity of Quebecers who massively respected the curfew this weekend. Thank you. I would also like to thank police officers for their work. We asked them to give fewer warnings, but more fines. We cannot accept that a few irresponsible people put the population at risk. And when I say at risk, I'm thinking about the situation in our hospitals. The situation is critical, especially in the Montreal region. The first reason for continuing all our efforts is to help our health workers. The other main reason is to reduce the number of deaths. We need to protect our vulnerable people, especially those over 65. They represent 80% of hospitalization and 95% of deaths. I ask Quebecers to limit their contacts with them as much as possible. We're in the last miles of our marathon. Now it's not time to give up. We have good news with the vaccine. We're now vaccinated half of the residents in our CHSLD, and we're vaccinating our health workers, so we see the light at the end of the tunnel. But we still need to reduce our contacts with people over 65. I know that Quebecers can stay united and help each other. Thank you for playing as a team. Je passe maintenant la parole au ministre de la Santé, Christian Dubé.
And now the Minister for Health, Mr. Dubé. Thank you very much. So hello, everyone. I would like to perhaps say a few specific words, 3 or 4 points on the vaccination, but I would like to start by thanking our entire vaccination staff. What the Premier just said, in a pretty record time and in difficult situations, we've gone from influenza to COVID-19. I think it's important to thank the people in the field because they are doing a really great job on top of all the other work that is being done. So I would like to give you a few statistics. You know that we like charts. So I'm going to show you another one. Remember that we still have our 10 categories of priority. If we really concentrate on we're concentrating on the first 4 right now because we're in the vulnerable group and healthcare staff. But what the Premier was showing here is that already when we have the hypothesis of vaccinating 75% of the people in CHSLDs, it doesn't mean that there's 25% who don't want to. It's a hypothesis that we're bringing. We would already be at over half that is done. So that is extraordinary. But what is even better is that as planned, within 2 weeks at the very latest, all staff at CHSLDs will have been vaccinated. And that is excellent news. In the 80,000 people that we're talking about earlier on, 90,000 people, we already have over 60,000 people who have been vaccinated. So that is the first point that I wanted to make. So we are truly aligned. As long as the vaccines keep coming, as the federal government has committed itself to supply them, our objective to get 250,000 by the 8th of February is truly something that is attainable. That, for me, is important. Now, this week, and I just want to give a bit of a warning ahead of time, because you know that we publish statistics for vaccinations every day. We've had days at 13,000 once again, and yesterday, in the report that you had for today, a little bit over 8,000, and now we are pretty tight because the vaccines that are arriving this week from Moderna and Pfizer, they can't arrive, one day later because we wouldn't be able to vaccinate at the speed that we want to. So you will recognize me. I'm saying, please send us more vaccines. We're ready. That is a message that I want to give, and to tell you that our teams are there. We are awaiting over 46,000 vaccines from Pfizer, and from Moderna, 34,000. So we are able to do so, but it's tight. So if ever you see a slight decrease, a day or two, it might be because there were delays in receiving the vaccines, because right now we can truly vaccinate correctly and we're ready to do so, and that is also good news. Now, I would just like to bring clarification on the question of the second dose, because it's been talked about a lot. A lot of people are asking questions. And remember, at the beginning, and now I'm saying, we were in December. Remember, we had our meetings on the 14th of December, on the 21st of December, and up until the 28th and 30th of December, we were reserving the second dose for the people who had been vaccinated. And what we've managed to do, and there's been discussions with different Quebec health groups and with the federal level, in discussions with Pfizer, what we did was to decide to use all the doses, and that's why things are going so well right now, because we've been using them. And there's discussions with public health in order to see with the manufacturer and the National Commission to see whether we'll come back to that 3 weeks that was originally planned, or whether we, in our scenarios, we had put it up to potentially 3 months. Are we going to be able to find a compromise between the two? That is something that we're following very closely. So I just wanted to tell you right now that the decision, as soon as it is communicated by public health, I think that it is a question, of a few days. We'll get back to you with the information. I'm going to stop upon those words. The summary is just that vaccination is going very well. That's what I wanted to say. And once again, I wish to thank the teams. Now, if vaccination is going well, the situation in hospitals is still worrisome. And I think that is why we wanted to have Dr. O'Patterney, who is in Ms. Savoy's team, and I'm reading her title because I don't want to forget. We're very lucky to have these experts, high-quality experts with us. Dr. O'Patterney, who is at the General Direction of University Affairs, Medical, Nursing and Pharmaceutical. And she's also the Assistant Deputy Minister for the Ministry of Health and Social Services. And I think she's the best person to talk about the situation in our hospitals. Lucy? Yes, thank you. Thank you for giving me the opportunity today to give a little bit more detail on what is happening in our network in the field right now. In fact, the situation presently in the hospitals of Quebec is very critical. The increase of cases and hospitalizations imposes enormous pressure on the network as well as the workers, despite all the efforts deployed and all the measures that have already been set up. Unfortunately, certain patients risk serious consequences. The majority of hospitals in Quebec right now are at the maximum level of leaving elective surgeries aside and have a hard time doing oncological and emergency surgeries. If that trend continues, there might be too many patients in intensive care, whether it be COVID-19 as well as other diseases and illnesses. This would force the network to make even more difficult decisions than they already are. If we take the Greater Montreal area, the number of hospitalizations has almost doubled since mid-December. There were about 472 on the 11th of December, and it went up to 1,071 yesterday. It also must be understood that the situation is even more serious because of an important lack of staff. In the context where the hospital resources are deployed to go and help in the elderly centers because there are outbreaks and that there is very high community transmission, which brings a lot of cases in care units. Many activities are going to have to leave aside, whether partly or entirely. For example, semi-urgent surgeries, screening of colon cancer by coloscopy, kidney transplants coming from live donors, with the exception of the pediatric clientele, a lot of non-emergency consultations in specialized clinics, like in family medicine. So you will understand that the impacts are huge and will be felt for many months, perhaps years, because of delays that are being accumulated in the waiting lists. The choice of activities to be left aside, which is made together with expert groups, is more and more difficult to do. I therefore reiterate what the Premier said, as well as Minister Dubé, and I ask the public to please respect the health guidelines that have been set up. The consequence of not respecting these guidelines will be dramatic for the network, as well as for patients and the public at large. I will take a moment here to thank all the healthcare workers who are working so hard, relentlessly for the past months. Paramedicals, pharmacists, lab technicians, nurses, doctors, and all others. We know it's difficult. We know that you have been stressed and you are going through fatigue and you have been working in those conditions for months and months. And I wish to thank you personally for all your work. Thank you. We will now take the question period.
Donc, on va débuter avec Marco Beller-Cirino du Devoir.
Oui, bonjour à vous tous. Ma question s'adresse à la sous-ministre adjointe. Madame la sous-ministre, des établissements...
Madam Assistant Deputy Minister, have healthcare follow the protocols for intensive care access, or are some doing it? That is to say, the difficult time of treating one patient rather than another, is it now time to do so? No, for the time being, we have not deployed that protocol that makes those choices. That being said, the network has been requested to set up webinars, training, and teams to be able to look at the protocol and to even do simulations in case it would have to be used. This exercise is something that we considered to be only hypothetical a few months ago, and unfortunately, the possibility of at some point having to have recourse to that protocol is becoming more and more of a possibility. And when you speak of possibility, are you saying in the words, in the days to come or weeks to come? We're talking more in terms of weeks, and that is why we don't want to have to wait. With the predictions that we have from the INES, we can plan for a few weeks. So, of course, we don't want to have to wait till the last minute to set up difficult choices to be able to get there. And that is why we are trying to do things and to set things up now in order to not get there. Doctor, you mentioned that there are certain patients that might pay the price. Could you give a concrete example? I'm talking, for example, of somebody who needs a coloscopy to screen a possible colon cancer, and we can't give them a date. I'm thinking of somebody who, yes, perhaps it's not a question of life and death, but there's pain when they walk and they can't get their hip replacement prosthesis. We can think of all sorts of cases. Right now we have 140,000 surgeries that are waiting to take place. Mr. Dubé, you were talking about the fact that you can take more vaccines than what you're having right now, and they're expecting about 80,000. In the calendar that you showed last time, I thought that it was the Monday that you would be receiving them. Do you have them? No, but that's what we explained, and I think that Mr. Paris explained it as well last week. I'm just giving the example this week of the vaccinations don't always come at the beginning of the week. This week, on the Pfizer side, they arrive on Tuesday, Wednesday, Thursday, and Moderna, they arrive on Wednesdays and Thursdays. So that is why that when you see the number, I'm telling you, this week we're expecting 80,000. Well, it doesn't mean that they arrive on the first day of the week. So when I say that we were able to vaccinate up to 13,000, and I would say that right now we are experiencing our most difficult distribution conditions. In CHSLDs, it's not, mass vaccination that we're doing. So that is why I'm saying that the teams have worked really well. But taking into account that we are still in our difficult conditions in CHSLDs, what we'd like is for vaccines to arrive even more quickly so that we have no interruptions in our vaccination process. But up until now, I would say that Mr. Paris' team, they've done extraordinary work.
Bonjour à vous quatre. Vous avez dit, Madame O'Patterney,
Ms. O'Patterney, you said that the majority of hospitals in Quebec are at the maximum level of leaving certain procedures aside. The situation means that certain hospitals are forced to transfer hospitals elsewhere in the network. Do you have any numbers to give us on that as far as the transfer of patients to other places? I do not believe that I spoke of transfers of patients in the network. We have, for example, as far as patients that need intensive care unit beds, it's not all hospitals that have the capacity for COVID patients. So sometimes there are transfers from those patients towards other areas. For example, there is somebody at Anna-la-Berge who was transferred at Bad-Ver in the Eastern Townships. For the time being, we really are trying to have care that is given locally. Mr. Dubé, once the vaccination will be finished in CHSLDs, you talked about 2 weeks being the objective. Are you going to use big spaces like Congress centers for mass vaccination? Well, first, I would like to remind you that we have to think of finalizing the healthcare staff first, and they will be vaccinated in the same places. If it's not in CHSLDs, it's in hospital centers. And also remember that the third group here is what we call the RPAs, the residences, private residences for the elderly. So we're not yet at mass vaccination, but already vaccinating in the residences for the elderly and in hospital centers is a lot easier. So that is why we wish for the federal government to be able to deliver its objective, because we can vaccinate more and more quickly now that we have gone through the more difficult zones. But what is coming up will be difficult. I mean, it's coming in a few weeks. Mass vaccination. We still have some priority groups left, but I imagine that there's a plan. Well, yes, of course, because in order to be able to have 1.3 million doses at the end of March, we're going to have to accelerate the pace. But once again, I repeat it, and I've said it often, we depend a lot more on what we are supposed to receive from the federal government than our capacity to vaccinate. And I've said it many times. We've already vaccinated not so long ago for the flu, 250,000 per week. That's a lot of vaccines, and that's not where we're at right now. It's almost, like a dry run that we're doing right now. Dr. O'Patterney, you mentioned procedures that are no longer taking place, kidney transplants, certain oncological situations. Is this everywhere in Quebec or only in certain regions? And if so, which ones? So the offloading of medical procedures is done pretty much everywhere in Quebec, although it is mentioned today that the situation is particularly critical in the Greater Montreal area, but still medical offloading is being felt everywhere. For example, let's take the Saguenay area. They had a lowering in the number of cases for a few weeks, but their operation rooms are still closed at about 60%. That being said, there are surveillance committees in all establishments to be able to look and prioritize the different clinical conditions. So, for example, oncological surgeries are preserved in the greater part. As a follow-up on vaccination, it's for the second dose, which you talked about briefly. Ottawa on Friday last mentioned that the question of the second dose was not just a question of whether it makes the vaccine more or less reliable, but also a question of supply to convince pharmaceuticals to deliver the doses as planned. It had to be showed that we followed the prescriptions that they themselves stated, and that otherwise it might create a problem if this was not followed. So is Ottawa putting pressure on you, on Quebec, for the administration of the second dose more quickly? And if so, is that what is pushing you to review your strategy? On that point, I will let Dr. Arruda answer because he's the one who's at the forefront of negotiations with public health in Canada. If you allow me, in fact, you have to know that we had advice from the Immunization Committee of Quebec, like elsewhere, like in Great Britain, where we believe that in the context of a pandemic, where there are many people who are dying, in the context of the efficacy that was shown with the first dose injected, that it would be more adequate to protect as many lives as possible to use all the doses that we receive right now. Where the debate is right now is on the interval. And we said that we were going to give 2 doses. We're not saying that we're only going to give 1. We want to use the vaccine as optimally as possible to protect as many people as possible in a shorter lapse of time. So as we go forward, and along with the discussions that we have and the advice that can come from the National Committee of Immunization of Canada, who's also starting to look at that time lag, we'll reevaluate the situation. We're going to make studies in Quebec as well to see the efficacy of the first dose as such, and we'll follow what is being done elsewhere. And depending on what will happen right now, we will see at what moment we will fix for the second dose. But be assured that what we're doing is based on scientific analysis supported by the Quebec Immunization Committee. My question was to know whether Ottawa is putting pressure on you and that whether it's to ensure the supply. Well, to be very clear, first we would want for it to government of Quebec and not the federal government that decides what the procedure is. We prefer vaccinating a maximum number of people. It's a question of solidarity. It's true that it's perhaps not as secure per person, but we also are able to vaccinate more people. However, what the federal government has told us, and where we have to comply, of course, is whether there is a real risk that a company like Pfizer might stop delivering doses because we're not respecting the delay between the 2 doses. Well, there, of course, we would comply if it would lead to stopping procurement of the second dose. But if we have the choice and we want it to be the government of Quebec that makes that choice, we prefer vaccinating more people.
Bonjour à vous quatre. La question est, en fait, il est évident qu'une vaccination.
It's obvious that massive vaccination, such as what we see, brings about a lot of challenges. Do you think that all medical staff in Quebec will be vaccinated? And what is the percentage of vaccination and healthcare employees in Quebec right now? Well, I'm going to go back to my chart because I think that an image is worth 1,000 words. As you can see, when we made our calculation, we were saying that in the healthcare system, we're talking about 325,000 people, and that includes all the staff, excluding the administration. So we really understand these are people in the field. It includes doctors, healthcare staff. But it also includes people who take care in community settings. It really is all the staff. And we're making the hypothesis, once again, of 75% people getting vaccinated. So today, the good news is out of 240,000, we have over 25% that's already done. So for me, that's important. As you can see here, when we have almost 100,000 more, we would already have another 40%, say, that would come and add itself, and that is only as of the 8th of February. So we could see that by mid-March, we would have finalized all the care staff, and that is why we have processes that work parallel to this, because once we see that we have the essential and there's different levels of priority within the healthcare staff as well, then we can start with the residences for the elderly. So we're not waiting to have completed. We are going to the other priorities as well. Does that answer your question? So it's March. That's a question. That's the answer. Okay. 100,000 vaccines soon in Quebec, but what about certificate of vaccination? You talked about it, and Ms. Elliott in Ontario is talking about it as well. Is the government of Quebec still working on a vaccination proof? Organizations like the Festival d'été, Osheaga, and train companies and airline companies want one. Well, first, in Quebec, we already have a great advantage because we already have, with Carnet de Santé, we already have proof of vaccination, which is available. Now, as I had already explained, and I think that Dr. Arruda can complete as needed, how will we be able to easily show that evidence if organizations, as you were saying, Oshaga or whatever, the Festival d'été, if they could require it, airline companies as well? Well, for us to present it, it's pretty easy because it's already in our habits to have it. So it would be a complement to the vaccination booklet that we already have, what we call the carnet? Yes, thank you. Maybe my question is for you, Dr. Opatrny. There's many hospitals that are over 80% of occupation of their beds right now. At the General Hospital of Montreal, the Royal Vic. What are the hospitals in Montreal and in the Greater Montreal area that are at higher risk of having to move patients around? And would it be necessary perhaps to ask patients in emergency to not go to those hospitals in particular? Thank you for that question. It gives me the opportunity of showing you a chart myself. So you can see here, and this is for the Greater Montreal area. So in blue here, you see the increase of hospitalizations. And the orange line, I don't know if you can see it, if I put it this way. The orange line are the beds that right now are physically occupied. And the red line is the capacity that we've given ourselves on paper for COVID patients. But what you can see here is that, yes, we have on paper further capacity for COVID patients. However, there are other people who are in those beds right now. So that is why, and that goes together with the fact that we have to treat other diseases, but also because there were bed closures because of a lack of staff. That is why right now the guideline has been given that unfortunately in the Greater Montreal area we have to reduce the number of surgeries, whether they be one day or other, to reorient the nurses to be able to reopen those beds that were closed to increase the hospital capacity everywhere. It's not just a question of the Jewish General Hospital or Maisonneuve-Rosemont. It really is a question of the Greater Montreal area, generally speaking. And Lucie, if I just want to add, or Dr. Opatrny, sorry, just for cases, could we give, for example, the example of Annette Auberge on the South Shore, where in the past few days we had to ask people to not go because there was already it was already overburdened? Are there any other examples that you could give us? You know the network pretty well. Right now, I wouldn't say that the situation is really changing from one day to the next. And the context is critical pretty much in the entire Greater Montreal network. So saying to avoid one, it's not going to make it go better in another one. So it really is a collective effort to see how to increase our present capacity. So I wouldn't give any guidelines to avoid one hospital rather than another right now. Mr. Legault, last week, your Deputy Premier, Ms. Guilbeault, indicated that she did not want for police officers to give tickets to the homeless. This morning, there was one person, a homeless person, who was given a $1,500 fine. What prevents you from not setting up an exception for those people? Well, first, I spoke with the Deputy Premier this morning about this. What I was told is that there were 122 cases with homeless. There were only one person that received a ticket, somebody who's known by police officers in the Montreal area. And I think that as far as the reasons and the context is concerned, I would prefer for that question to be asked directly to the Montreal Police Force. As a follow-up to what you were talking about, unfortunately, the difficult possible decisions that may have to be made, is there any question of making choices using age as a parameters? And if so, when would that be? Well, you can see that we are making decisions according to the age. That is, to quickly target and vaccinate all those people who are older, because those are the ones who are the most vulnerable. So those are the ones that we wish to protect the most. Now, as far as the decisions of medical intervention are concerned, those are made on a per-need basis and on a basis of emergency. It's not a question of age in terms of giving that care. Mr. Dubé, I'm informed that at the DSQ there was a power outage. You know, Health Quebec, who manages the medical records. That's pretty worrisome in the middle of a pandemic. So for the past 48 hours, there's no information, computer information on medical files of patients. That's correct. So just to reassure people, it is not a cyber attack or anything like that. It is, unfortunately, a simple computer program. It's a problem with the software. And you're right on one thing as well. It really is the system that allows, amongst others, you know, that allows us and allows doctors to have access, for example, to imaging in your file to see what x-rays you've had, etc. So it is an important part of our healthcare system. And when people wanted to start the system back up again yesterday morning, the same problem prevailed. Usually when there are, you know, bugs and these kinds of problems, you make a few adjustments and you reset the system. And unfortunately, when they tried to do that, there was no correct solution. People are working on it, but I just want to reassure everybody we're not here in the context of a cyber attack. It's just a problem with the software that our experts are going to try to fix as quickly as possible. When will it be fixed? Well, like in any computer problem, you know, we want it to be fixed yesterday, and our people are working on it. They're doing as quickly as they can. 1.3 rapid tests have not yet been used. Are you planning on using them to screen COVID-19 in working environments or schools? I am going to take heed on that because that is a debate that's been lasting for a while. I would perhaps like to take a step back to answer your question. First of all, in terms of screening, we, as a position, including public health, we have absolutely nothing against rapid testing. But we know that in Quebec, we went where, you know, screening was really our strength. We have every test. We have all the necessary equipment to be able to conduct our testing with the tools that we have, what we call the PCRs. And we do not need having more equipment, for example, in rapid tests. And one of the reasons why we have not felt the need for that, and despite the fact that we have tried it in many different places, it's because we are not lacking any tests right now. We can quickly answer and respond to those who get tested. It's not like at the beginning where we had issues, you know, with other issues. But why? And I don't want to give any names of companies or anything like that, but the larger percentage of the tests that we have in the inventory are the ones that are not as reliable as the ones that we have, you know, in PCR testing. So for the time being, and I would say under the present circumstances, we do not need using them because people are perhaps going to ask me the question again in a week's time or two. But right now, we do not need those tests because we have enough with ours. We master them well, the PCRs. And on top of it, you know, we're not going to go and replace tests that are doing well in very correct, you know, in enough time, and replace them with tests that don't have the same reliability. So that's what our answer is right now. For now, will there be other movements? Will there be other pilot projects that can be done? Perhaps, but our question very clear right now is we don't need it. And if I could just say one thing, there is no lack of tests in Quebec to be able to screen. We have one of the best tests. What I want to remind you of right now is that if you have symptoms, and particularly the parents, you know, because school has started, there's no flu right now in Quebec. So if your child has symptoms, keep them at home and get them to have a test and isolate them. Don't wait for 24 hours. We're not at all in the same situation as in the spring. We are in a period of high transmission. So whether there be rapid testing or not, the test that we use is something that, we decide based on the recommendation of experts. It's already being used in certain places where we believe that there's a benefit to them. But what I want to remind the public of, if you have symptoms, you isolate yourself, you call, you go get screened, and you wait for the result. And once public health calls you, you collaborate with them so that we can break the chain of transmission. It's very important that people get screened right now. And I wish to mention as well that despite the fact that there's a curfew, everywhere in our day, we have to apply the measures that are important. Even while we vaccinate right now, we still need the 2-meter distancing, we still need to wear the face covering, and we need to wash our hands. So we expect that open areas to apply that with rigor as they did in the spring. And if I might, just to complete my answer, because sometimes, when I listen, I want to say other things. What I want to mention is that it's a choice that we made for rapid testing to not apply them massively. And very often what is heard is, why aren't you applying them, for example, in schools or in work environments? It's because it's a choice where we said when we have important testing to be done and we have to do it massively, the tests that we have right now respond that need very well. So I just wanted to bring you the clarification, because there might be smaller cases, but if we're talking about 1 million tests, we don't need those right now. We have what we need to be able to conduct what we need to conduct. So if we have to apply even more conditions, what would you close first? Schools or certain work environments? Well, listen, for the time being, we believe that the measures that we have already set up, the curfew, what we're targeting with the curfew, and we saw it over the holiday period, is that there are still too many people in homes that are going and visiting people who are 65 and over. So that's why we put a curfew at 8 p.m. And, people like France, places like France, they have it at 6 p.m. And that allows us to reduce the number of private gatherings, including with people 65 and over. So if we are able, and we are optimistic, we believe that we are able, with the curfew, to limit the number of private gatherings. And once again, I make a call out. I implore Quebecers to not, unless it's absolutely necessary, to not go and meet with anybody who's 65 and over at home. Hello, everyone. Dr. Paterny, you talked earlier on about the kind of moving of, the nurses who are being moved from one place to another from surgeries to be able to open COVID beds. But there's a specialist that was saying that respiratory therapists, could also be brought from other regions because they're also necessary for the treatment of COVID. Is that a solution that is also on the table, bringing them from other regions to the Greater Montreal area? I would never say no to potential solutions, and we consider everything, except that there are other regions that are a lot more fragile in terms of their capacity. For example, La Côte-Nord, they have about 10 intensive care beds, so it doesn't take much. It doesn't, require a big outbreak to quickly fill those. So I think that we have other potential solutions before transferring health care professionals to the Greater Montreal area. You said that yesterday was 72-73% of vaccinations that have been administered. Today, it's over 80%. Up to what percentage can we go? Can we go up to 90% of deliveries for the vaccine to go right to a patient's arm? Well, I think we're reaching our maximum right now because, as I was saying, let's take very simple numbers. Let's say that right now we have about 20,000 vaccines to be done for 20%, and we are able to do 2 days at 10,000 like that. So if the vaccines were not to arrive tomorrow, that means that Wednesday we can't vaccinate anyone. It's to tell you to what extent the delivery from the federal, according to the guidelines that were given to us, is important, because what we do, and I'm using the English expression, to do just in time, that's what we're asking Mr. Paris. It's to make appointments based on the predicted delivery of dosage, according to the schedule. So if we expect Pfizer to come in on Tuesday, then we can deliver on Wednesday. So that is why I've been warning that if ever you see a number of 6,000, for example, or 4,000 on Wednesday or Thursday, it's not because our team does not want to vaccinate. We have people who are very competent, but we need vaccines to arrive in time. Just to make sure that I understand, you give, even before you get the delivery, you give people appointments? Well, yes, certainly, because what we have to be able to do is to look, there is a prep time of Pfizer vaccine that arrives tomorrow. You know that the system is pretty complex. They come in plateaus. There's a preparation time, and then you have to distribute it. So that entire logistics, and that is why I'd like to remind you that Mr. Paris' team is doing extraordinary work. But we don't want to say, well, now that we have it in such and such a CHSLD, now we're going to call and say, hey, who wants to get vaccinated? No. We have made the choice of being able to tell people, listen, if everything goes well, we're going to start vaccinating Pfizer on Wednesday here in this specific CHSLD. We will now go to English questions.
Good afternoon. I'm Christine Long. Mr. Legault, CTV says there was reports in CHLDs after vaccination, people were getting sick and that there was an investigation into that. I'm wondering the results of this investigation and if you have heard about anybody getting reinfected with COVID after their first dose.
In fact, we knew that there was going to be some cases appearing even after vaccination because there was already outbreaks in that field. So it's needed to look at exactly the story of each case to be able to understand when they have been infected, when they've been vaccinated, when did the symptoms begin. Those investigations are under thing now. And we will do that anywhere where there's going to have been people vaccinated to be able to understand. We know that the vaccine has a high level of percentage of efficacy, but there is always people who cannot be protected, especially if you're older, probably the vaccine efficacy is lower. But actually, the cases that we have seen on those places are not what we call vaccine non-efficacy. It's because they were already people who have been infected before getting the vaccine. And even in the trials, from the pharmaceutical perspective, it happens. In the 14 days after getting your shot, there is people who get sick, and that is not part of the vaccine efficacy.
And Mr. Dubé, if you could repeat what you were saying about the quick tests and where they're located and the need for quick rapid testing, please?
Yeah. Well, what I said is first we need to establish that we have nothing against rapid tests, but since the beginning, especially in the second wave where we have been able now to test 35,000, 40,000 a day and even more than that, we don't need additional tests than the one that are very, very strong and very reliable are the PCR tests. So our first point is we don't need that. Where we would need, and this is the reason we have made this choice, that we don't need to use the rapid test, okay, because they are not as reliable. And this is the reason why a lot of provinces have made those same choices, that they're saying, well, we don't need them unless we are missing tests. But in our case, we don't miss tests. And that's the reason that so far we have made that choice that we're not using them for the massive testing as we have been doing since the beginning of the second wave.
And maybe I will add something.
Yes, please.
I take a chance because what I heard, what I understood is that the rapid tests are slow tests to take the test. All right, it's faster to get the result, but if you want to test 10 people, it's faster to use the regular test than what they call the rapid test. So the rapid test is a slow test in a way.
But I just want to add something that I said in French, so I want to make sure that English people speaking understand.
Thank you.
There is no problem of access to testing actually in Quebec, as we had in springtime. And actually, there is no cold going on. So if you are sick, if you have symptoms of cold, if your son is sick, please get isolated, go take a test, and take care of the result, and public health will call you back, because it's very important. We see that people are getting less tested, but it's not because there is no capacity. So I think it's very important that people remains that. And at the same time, even if we have big measures, don't forget, even every day, even in contact with your family, elderly people, as told the Prime Minister, it's important to get the distance of 2 meters, the mask, and hygiene. This is critical. It is critical even if the numbers are going to go down. There's still a big impact on the healthcare system, and we don't want people to have problems, not access to care, because we won't do the job. The vaccine is going to help us a lot, but you must keep your strict hand hygiene, masks, and I would say distanciation. Don't forget that at work, even during break time, when sometimes people at the dinner time, they take off their mask and they eat together. This is a risky condition with the virus circulating as much as it is in Quebec everywhere.
Thank you.
Next question.
Obrigada.
Yep.
Hello, Michelle Lalonde of Montreal Gazette. My first question is for Minister Dubé. I spoke to the head of a critical care department of a small Montreal hospital today who said his ICU is already over capacity, and the main reason is a lack of nurses and respiratory technicians. He says the problem in Montreal at his hospital and many others is that these nurses and respiratory technicians who operate the ventilators have been hired away by private placement agencies who pay more, and they guarantee they won't have to work overtime, weekends. They provide these staff members back to hospitals, but they won't work on those difficult shifts. So he's asking, can the government do something to force these private placement agencies to provide staff 24/7 like other healthcare workers are working in this crisis?
First, I didn't hear in which hospital you...
It was Maisonneuve-Rosemont.
Maisonneuve-Rosemont.
He says that they're at 20 patients, and they have room for only 18 if you look at their staff. They have more ventilators, they have more equipment and more beds, but in terms of really being able to
The staff is a big issue, but I would like maybe ask Dr. O'Patterney to comment on the situation in Maisonneuve-Rosemont if she wants to, because it's...
So it hasn't come to our understanding that there has been so much of a purge in terms of healthcare professionals away from the ICU as you're describing. That being said, the issue of a lack of staff is huge. And it's a bit of everything. It's a bit of the fact that I mean, if we look at last year, so that is the underpinning crucial matter. And if we look at last year, people think, well, you know, last year we had 6,000 beds free. Why couldn't we come up to that? Well, we had let's take nurses, a certain amount of nurses last year. Well, some of them have to be home because of immunosuppression or they're ill. We open up centres de dépistage. They're reaffected towards the CHSLDs and other areas. We open up more centres de dépistage. So there are many fewer nurses. Even if there are, for example, a few that have opted for different options such as agencies, the huge amount of absenteeism for different reasons or for reorientation towards other sectors are really the critical reason why we're lacking personnel in the hospitals.
And can the government move those nurses, for example, that are at larger hospitals, can they be, and respiratory therapists, can they be moved to smaller hospitals? Because he's saying some places have more than they need right now and his hospital has less.
Well, so we're trying to do through multiple mechanisms, everything we can to increase our bed capacity. And as you well mentioned, when we say bed capacity, we don't mean physical beds, we don't mean physical ventilators, we mean staffed beds. And so there are a large series of actions that we've put into place and are looking into place to try to do it. If a certain small hospital is over capacity, well, a patient will be moved to a different institution with a larger capacity. So there's either moving personnel or moving patients is the other option, of course.
Thank you. My second question is for Premier Legault. Can you tell me, given this critical situation that we're hearing today, why isn't your government considering at least as severe a lockdown as we saw in the spring? Clearly the second wave is much more serious.
Okay. First, it's important, and that's why I've repeated that last Wednesday and today. We have to concentrate on people of 65 years old and more. 80% of the people in hospitals have 65 years old or more. 95% of the deaths have 65 years old or more. Most of these people, they don't work and they are not at school. They are at home. So our challenge is really try to have less gatherings in homes in Quebec, especially with people of 65 years old and less. So that's why I think that the curfew is the best measures to reach this objective to slow the gatherings in homes, especially with people of 65 years old or more. I don't think that if we close more companies or close more schools, that we would solve our problem. Our problem, and it's important that everybody understand, these people are vulnerable. We have to protect them, and we have to reduce the number of gatherings in homes, especially with these people.
Thank you.
Next question, CBC.
Yes, for Dr. O'Patterney. Can you paint a picture of, in the Montreal region, as you did in French, what are the problems of capacity that ICUs are facing, and how many patients have actually been physically transferred to another region or another hospital because of those problems?
When we talk about issues of capacity, we're talking about that we have issues in capacity both with short-term care beds as well as ICU beds. So both of these areas are problematic and in the Greater Montreal area. And the question was, is there any particular hospital to avoid? And the answer to that is, well, right now, pretty much all the hospitals are increasing in terms of the pressures being put upon them. In terms of transfers, we have a system to try to equilibrate the number of patients who have COVID-19, both in the acute care beds and in terms of the ICU beds throughout the Montreal area. So that we don't have one hospital that has 100% of their capacity and another one 25% just because of where a patient has presented. So the vast majority of transfers are within a given region to try to equalize things. There have been very few. I can only think of one interregional transfer from Montreal to Greater Montreal area to another region at this point.
And what about in other regions? Have there been other interregional transfers?
So the situation right now is particularly problematic in Montreal, but let's say end of November, the situation was very problematic in Chicoutimi. And so there were multiple transfers of lung cancer patients towards Quebec City to be treated, as well as there was an outbreak, and so there could be almost no cardiac surgery, and equally from Chicoutimi, it was transferred to Quebec City. So there have certainly been a number of examples. Before Christmas, the Quebec City region was incredibly hard hit and had to reduce its number of surgeries. And in that context, for example, Trois-Rivières took over certain cardiac cases. So depending on the situation, there are corridors of service, I don't even know if that's an English term, in terms of trying to make sure that that people who have problems that are acute, that cannot wait, are treated throughout the réseau.
And just a question for Mr. Legault on the decision to delay the second dose of the vaccine. The federal government is suggesting, and you talked about this in French, that may threaten procurement because manufacturers would be reluctant to distribute vaccines to people who don't follow their recommendations. How concerned are you that your decision to delay that second dose might threaten Ottawa's ability to purchase enough vaccines?
Of course, it's the federal government who's discussing with the companies like Pfizer and Moderna. Of course, if it has a real impact on procurement, we wouldn't continue. But if we have the choice, we prefer to vaccinate more people than give 2 doses to the same people.
And you're comfortable with that despite the fact that it ignores the manufacturer's recommendations?
I can understand that the manufacturer, they would prefer, if they want 100% efficiency to their vaccine, that we give the 2 doses. But as a society, it's a question of solidarity. I prefer that we have more people that are protected, that, let's say at 70 or 80%, than have fewer people protected at 100%. It's a question of solidarity.
Thank you.
And lastly, we have Gloria Enriquez from Global News.
Good afternoon. Studies conducted between August and December found that students in schools are high vectors of transmission. Researchers fear having kids in school will increase the risk of community transmission. What does public health know now about how kids transmit the virus and the risks of spreading the virus by keeping schools open?
Okay, I understand very well that there's a risk of bringing back the children in the schools. But we have to put in the balance that there are other disadvantages to keep them at home. Social disadvantage, learning disadvantages. And also, what is important to understand is that the important negative consequences, the probability are very low for children. They are very high when you're older. So it's a question of the balance between, and we know very well that many of our children, they missed many weeks of school last spring. So for me, it's important that they keep on learning and being in our schools, even if there's a very small risk.
Perfect. And my second question is for you, Mr. Premier. Many restaurants are using delivery platforms like Uber Eats or Skip the Dishes during the pandemic, and the delivery fees are pretty high. Montreal Mayor Valérie Plante says she would like the provincial government to impose a limit or a cap on these fees. Is this something that you are considering?
We can look at that, but in practice, it wouldn't be easy to do that. But I guess that it's a question of how much the restaurants want to charge, how much the customer is ready to pay. You know that the principle of Uber and those services is that you pay more when the demand or the offer is not large. So we can look at that, but I'm not sure in practice it's realistic to put some rules and make sure that they are respected.
It's really the fees that the restaurants are charged in order to be a part of the delivery platform.
Yeah, but it's a question of how much are you ready to pay to receive your meal at midnight compared to at 6 p.m. It's offer and demand.
Thank you.
Monsieur Dubé a juste un dernier point à ajouter.
Peut-être que j'ajouterais là, pendant qu'on est tous ensemble.
I would perhaps add something since we're all together.
Juste au retour des fêtes, le 4 janvier.
Right after the holidays, on the 4th of January, we had offered nursing students who are at what we call the DEC back. That is, nurses already have their DEC diploma and are completing their training. We've already had positive answers to this offer. But today was the last day of the offering, and what we've been told by the number of questions that nurses were asking, that they would like to have a little bit more time. So I'm announcing to you today that we're going to be prolonging this by a few days, because I think they already have over 300 people who have registered, which would be, each extra nurse that could come and help us right now would be welcome. So we're going to be giving a few days. We're working a lot with Daniel McCann to make sure that that offering can be finalized. So, if we can increase that offering, we can talk about it also, where we're at with these grants at our next press conference. So thank you, everyone. Have a great evening.